I think primary care at Hartford HealthCare is different than other locations throughout New England, really because of the large network that we are practicing within. Practicing within such a large system allows us to be able to refer our patients to a large group of specialists, and so our patients really get the utmost greatest care possible. So I know that when I'm seeing a patient and referring a patient to a specialist, that they're really having a destination point of care. Making a difference in my patient's life is very important to me. And recently, one of my patients came to me complaining of abdominal pain. It was determined that the gallbladder was actually causing her abdominal pain, and I got her set up with a general surgeon who decided that she needed her gallbladder out. While she was having the operation, it was also determined that she was having some liver issues, and she needed to see a liver specialist. So she was promptly referred to a liver specialist within our group. So although the patient needed a lot of healthcare needs at this time, she was able to see a few specialists all within our group and really receive excellent care all within our network of Hartford HealthCare.
I think that one of the biggest things that makes our practice unique, number one, is the physician leadership. I think that's a really key aspect to our group. And I think that the initiatives that we have in terms of managing the health of our patient populations is really unique. We have embedded behavioral health clinicians in a lot of our offices. We have embedded nurse managers and social workers, and we really have a lot going on to try to manage the health of these populations. And so I think that's one of the biggest things that really makes us stand out compared to some of the other medical groups in our area.
I think the most surprising thing about our group, and the thing that I was most surprised about when I joined, was just the great communication. So we have great communication that comes all the way up from our leadership, and this is relayed down through daily huddles. We have monthly staff meetings, as well as monthly conference calls, and this is all just to relay information to all of the clinicians so that we know what's going on in the group, we know any changes. And aside from that, the leadership also wants to know what our opinion is so that we feel like we have a voice within the group.
Lean daily management in our offices, I think, is really a game changer. When I say lean daily management, that's the Hartford HealthCare terminology for process improvement. And that ranges from daily huddles in our offices where our staff gets together and talks about, key issues for the day, initiatives going on in the office, to real process improvement work where we might gather together to sort of take a look at a process like referrals, for example, and really how can we make that better for us and for our patients.
From the first day that I joined Hartford HealthCare to practice primary care as well as sports medicine, I felt like I was extremely supported in terms of the time that I needed to see patients, getting the referrals in to help me see those patients, knowing who was in our network so that I knew who to refer my primary care patients to.
What I love about this program is when I started right after residency, they supported me a lot as a new physician, first time, without any supervision. They helped me with mentorship, so I had a mentor who I can talk to about anything or any help I needed.
I think we have a great work-life balance. We fortunately use a hospitalist service to admit our patients. So, our work is all done in the ambulatory setting in the clinic, and we also have a call structure that is supportive in that we're not on call that often. So our call is telephone call because we have a large number of providers within our group. Our call is fairly infrequent. So I might be on call during a weekday every 6 weeks or so, and weekends, I think we probably have maybe 2 per year, so it's pretty reasonable.
My work schedule allows me to be home with my children, and I spend every weekend with them, so it's very conducive to raising a family.